It's week 2. Anybody have any questions about anything we're doing so far? Have you had a chance to look at the syllabus, look at future assignments, or anything that you need to understand? Any questions? Okay. As we go along, if you have any questions, please do not be afraid to send me a message, or if we're in the middle of lecture, stop me. I do not mind. So week 2, we're going to go over infants, toddlers, preschoolers, and I will be introducing the theorist into that and try to give you some explanations, some examples of what those mean to make more sense of it, because you're like, what does that mean? So let's give you some examples to try to help you.
Oh, excuse me. I apologize to interrupt.
No problem.
Question about the quiz. Are we going to be quizzing after this class, or is it scheduled for another time?
No, we are going to do it directly after class, somewhere between 4:45 and 5-ish. It will get done. So I'm figuring about maybe 5 to 5 o'clock. It'll be at the end. The reason why I did the first 2 quizzes at the end was to make sure that you understood what type of questions you might see. So that can help you get prepared for coming to class and doing the quiz, right away, okay? You'll see, where does the information come from? So that's why it was done that way. It gives you 2 times. And then the last 3, of course, is going to be at the beginning of the class. So quiz will be done at the end of class. They're all set up, ready to go. You will also have a discussion question that is due this week. I did look through the discussion questions from last week, and these are the things that I saw that were incomplete, so that you can get better than a grade of 14 or 11 or 12 or 16. So if you are less than a 20, go into the assignment and look at the comment I gave you. It tells you where your faults were. It could have been you didn't answer the question about nutrition. That was some of you, not many, but some, or some went back later and put it back in, which is okay. I don't mind that because it was there. The other thing that I saw was no references or not citing in the body of a paragraph. Citing the body of the paragraph is those little parentheses with the name of the book, comma, and the date of publishing. Okay, and I put an example in your discussion questions, what the book, our book, Perry, would look like. Okay, so if you need any help with that, let me know. But it was nice meeting you all. It was nice knowing some of you have been in LPNs or pharmacy assistants or MAs. It's nice to know who my group is. I may not remember who was what, but when you start talking, that information will pop back into my head. So today, as I said, infants, preschooler, toddlers, we'll be going over those and all the developmental stages. And then we're going to be doing a Kahoots. I did go in and renew it again from last semester, like I always do, to make sure the information that you need, those concepts are there so that you can be successful, okay? All right, you did get your PowerPoints on Monday. I finally got them out because I was doing some revision. So if you need it again, I will be sending you the recording. I always attach the PowerPoint again to keep it in one place for you, okay? So whenever you get recordings, you will get that class's material put there. The only thing about announcements, I can only put one attachment. So if it's more than one, you'll get a message in Canvas, just to let you know. I haven't figured out to put more than 2, put 2 or more. So here we go. Infants, toddlers, preschoolers, chapters 31, 32, and 33. So growth and development. Now, as I said last week, these children are born at 7 pounds, 6 pounds. They can't even lift their head. All they can do is suck and breathe and swallow, and they can sleep and they can pee and poop, right? That's what they do. As they get older, they're going to be getting to the point where they triple their birth weight and they're almost walking or they are walking already. So that's amazing, how a small human being can go from here to there. That's why nutrition is so important, especially in the first year of life. And even, mommies being pregnant with babies, very important, because again, they're growing from these tiny little nothings to 6 and 7 pound children within, the belly. So we know the central nervous system is the fastest growing system. The central nervous system, works with the muscular system. So then they lift their head and then they turn from front to back to front. And rolling over completely should be done by 5 months. Then they get up on their knees and they all crawl backwards. It's actually funny. First, then forwards, then they get up on the couch and they start walking around, and all of a sudden they'll start to take steps by 1 year old. So that's about the central nervous system and why it's the fastest growing. It's not the brain yet, cognitively, it's more about that motor function. So they gain 5 to 7 pounds of weight a week. They double their weight by 6 months, triple by a year, and they gain an inch of height per month for the first 6 months. Now, I think that when babies are growing, especially they're getting taller and more in length, all of a sudden you'll see them look pudgy. Then all of a sudden they'll look thinner. And it's that stair step sort of growth that they go along. And children throughout childhood, I think you see that, where all of a sudden your child looks pudgy and you're like, they're gaining weight. But nope, they're just about, I said, no, they're about to have another growth spurt, and then you see it. As they get older, all their vital signs start to change. So they're born a heart rate 140 to 160. By 1 year old, they're up to maybe 100, 120 heart rate. And respiratory rate still 30 to 40. It's 40 to 60 at birth. So these are things, they're starting being able to function better. They don't need as much heart rate or respiratory rate to do the same things. And that's what that means. Now, when the baby is born, they have all of mommy's good stuff. They have their blood, their iron, their hemoglobin, hematocrit. They have their immune system, all of that. But the baby does not start making their own blood till about 5 months. So what happens? Cells die. So what do you see in the infants? They could be born with a hemoglobin of 14, and by 6 months, they could be at 10. Absolutely normal. There's not bleeding anywhere. The cells are dying and they haven't been replaced. Well, the only problem with that is red blood cells carry iron around. So you're losing iron. So that's why we give iron fortified formulas. And that's why we'll give supplemental iron to those children who do need it, okay? Their heads at birth are huge. We've learned that in maternity. And their chest circumference is smaller. As they get older, their head does not grow as much as their chest. Their chest gets bigger. And by about a year, year and a half, you're going to see that they should be equal or the chest should be bigger by then. Now, children are born with those, quote, soft spots. They're called fontanelles. You have the anterior, and you'll have the posterior, and they close at different stages. Like, why do we need to know things like that? Well, what if you have the posterior fontanelle and it should be closed and it's wide open? Well, why is it wide open? That's the question. Not that it's open, but why? Maybe there's hydrocephalus going on, or maybe there's some sort of, there could be even brain tumors on young children, or something's not right. So it requires investigation. Also, if the anterior don't close, again, same things are looked at. And if they close too early, like the anterior fontanelle should be open for at least up to 14 months, something's wrong. That means their brain can't expand and grow. So you're squeezing that brain. So either way, not open or closing too early or open too long, all of these things are a change that we really need to look at. One of those developmental milestones. When they're born, they can hear, they can see, but they don't see colors. They don't know depth perception because they have binocularity, which means each eye works independently. So depth perception, they don't have it yet. They don't get that till about a year old, or a little bit less than that. As I said, central nervous system is the quickest growing, and it's the one that, puts the body, making it move and making it start to give those gross motor skills, right? So all of these things, feeding the nutrition that they need will allow this child to be physically where they need to be. Also, it feeds their brain food so that they can develop those cognitive skills, that not reflex palmar, but they do that little palmar grasp by themselves, or the pincher grasp, or making blocks too, or putting them in things. These are all cognitive things that these infants will go through. So feeding them good nutrition allows cognition and the motor.
I have a question.
Yes.
You said the palmar reflex grasp, is that usually by 2 months old they should be doing that?
They usually do that at birth.
Okay.
I know that I've worked a lot of the newborn ICU, and the parents will go over and touch the baby's hand, and the finger they put, and they all of a sudden they'll squeeze it and they go, "Oh, look, my baby gave me a hug." So I've seen it very, very early. And then that, reflex goes into voluntary. They want to grab that rattle. So that's showing forward progression and cognitive development. Okay, thank you.
Thank you.
So, no, thank you. Immune system, we know we're born with moms, and then the baby needs to start getting their own immune system. If they're breastfed, we know breast milk is giving mommy's immune system continuously to the baby. But, not everybody can breastfeed. It's not an easy thing to do. So we do give iron fortified formula, which is good, but it's not the immune system of mommies. That's why we start giving immunizations at the hospital, hepatitis B, number one, and then we start giving them 2, 4, 6 months. And we're immunizing children for those really bad type of things. We're talking about tetanus and pertussis, and diphtheria. These are those conditions that newborn infant does not have any defense against. So we're going to protect them with those things. By about 9 months, the baby starts making their own immunity, which means they're going to get sick. They're going to get viruses, upper respiratories, and ear infections, and urinary tract, and whatever. They're exposed all the time. Now, the body, once they get these things, is going to produce its own antibodies that they can protect them. And we know the GI tract has its own immune system that protects them. And if they're born with that cheese, and I think that's a great picture of that vernix caseosa, there's some children born with nothing, and there's other children that are covered in it. But again, it is a protection. It's the baby's way of doing that. As I said, at birth, infants are born, they cannot maintain their own temperature. There's no body fat on them, okay? And I know that if they're floating around in water, their body needs to get rid of that water, and they can't keep that warm too. So immediately we put them under a radiant warmer, or we're gonna give them a hat, sometimes socks, put them in a shirt and wrap them in blankets, depending on, what is the coolness of the room and the area where they're at. As they get older, they're going to maintain their temperature a lot more. So newborn infant's going to be needing maybe 2, onesies to go to sleep at night, or maybe, the all-in-one things, those little sacks and whatnot to keep them warm. But as they get older, they're not going to need as much, because all of a sudden now we are having increased adipose tissue, and it protects them, and they're not going to lose their temperatures like the newborn infant. Now, the baby is born and they have kidneys, of course, and they urinate. Now, the kidney function is different from adults. So we know that if you're looking at adult urinary function, minimum is 30 mLs per hour, right? That is the quote normal for adults. Well, we know children, everything is milligrams per kilogram, milliliters per kilogram. So an output of less than 0.5 mLs per kilogram per hour for 48 hours, 2 days. That's when we say that urinary output's not good enough. And it could have been dehydration, and dehydration and children do not work together, can cause multi-system body failure. So very important that we watch urinary output. Now, the one thing I can say is urinary output, you think about parents who breastfeed. There's nothing to look at. I don't know how many ounces the baby got. Did the baby get enough? Well, as long as they have 6 wet diapers a day, they are urinating enough, okay? You don't need to weigh the diapers, because if we look at urinary output in infants, you're like, well, how do we measure? Well, if a size 1 diaper weighs 30 grams, and we take one off an infant that's urinated or stooled in it, and we weigh it, and let's say it weighs 60 grams. The difference between 60 and 30 is the output, which is 30 mLs. And it's a very accurate tool to use, okay? Babies are born, their GI systems are very immature. They can't tolerate food, they can't digest it. If you give them food, it's just going to be in the stool when it comes out the other end. So we don't want to overwork that GI system. That's why for the first 6 months of life, all we're going to give is breast milk or iron fortified formula and nothing else. The only other time we give them something else is when babies have reflux, and we'll put a little rice cereal in the food because it thickens the milk and it will hold the food down. But if you look at their stools, you will see the rice cereal in it. But it's better than the vomiting, losing calories, than it is, you know, giving them this food which they do not digest. So here we are, we're talking about those fine motors and those grasping, you know, the reflex and the voluntary palmar grasp. Now, there's 2 types of motor development. There's fine, it's an F, fingers, okay? It's all about fingers. Fine is F, fingers, all right? Then there's gross motor, G, get up and go, 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 like Paw Patrol. Movement, okay? That's, you know, getting up, rolling over, getting on their knees, you know, crawling, creeping, walking. That, or, you know, even jumping and hop skitching, doing hop, or going upstairs, or all those things, anything motor. So that's how you know. When you have questions on motor development, make sure you look. Is it fine or is it gross? Okay, that will be the differences in answers. So the first thing is that involuntary little, at first is that reflex palmar. Then it's a voluntary palmar, grabbing that rattle and shaking it. And that's probably about 7 months, you'll see that going on. When they are grasping it, you know, they'll have it in one hand, all right? And then around 7 months is when they do switch it back and forth. That's showing more fine motor like that. Another thing after we do all about the palmar grasp and grabbing things is what we call the pincer grasp. Ever put a child, a young infant, in a high chair when they can, and you put those little puff things there or Cheerios, and they take and they get one and put it in their mouth? Well, they start with smushing their whole hand and trying to smush it and get something in their mouth, right? And then after a while, very finally, they can pick up one and put it in their mouth. And that's the difference between a gross pincer grasp and a regular pincer grasp. Then about 11 months old, they can put objects in or out of containers. Doesn't matter either way. And then by 1 year, it's a block of 2. So we'll have voluntary up to about, that reflex up to about 2-3 months, and then it will become voluntary. And then they'll grasp the rattle. Then they'll be able to change it. And then they'll start the pincer grasp, first crude, then fine. Then they could put things in and out, toys, playing, of course, and then blocks of 2. So I gave you one of these things here for you, so that when you go back, you can look and take a check. Gross motor, as I said, gross is get up and go, go, go. That's movement. So the first thing an infant does is head control. Now, the way that we measure the head control is by this top right picture, picking them up by their two hands to see if they have control in their head. At first, you're going to see that head lag, it's called a head lag. You should stop seeing that about 2 months old. Now, if you're 5, 6 months old and you pick them up, their head is still lagging, there's some neurological muscular problem. That's something developmentally that will need to be reported to your healthcare provider, okay? The first thing they do is on their bellies, they're on playtime, right? They're on tummy time, they call it. All of a sudden, they're turnover. That should be like around 5 months. Some kids are earlier, some kids slightly later, but about 5 months. By 6 months, they can go from their backs, prone position, and they can go over to their bellies. By 8 months old, they should be able to sit unsupported. And then at 10 months, they can go from their back and sit themselves up, doing all of those things. So if they're not doing something or it's not going in the forward fashion, this is something that needs to be reported. What do we do if they're not where they should be? Well, this is where we start that early intervention: speech therapy, occupational therapy, physical therapy. And as I said, kids are so resilient. They catch up really, really, really quickly, which is what I love. As I said, for 6 months of life, only the milk. And then you're going to start introducing food every 4 to 7 days, one at a time. You usually start with rice cereal because rice cereal has less chances of allergies. So that's usually the first one. Is it first fruits? Is it first vegetables after that? You know, every physician is different. So that would be up to them. So again, how do we know if they are eating right? I mean, especially those breastfed mothers, especially if they were in the newborn ICU and watch us measure everything in diapers, and they're like, I don't know, is the baby okay? Well, again, it is, if they're gaining weight, that's why you have frequent checks as a newborn. And then you go to the doctors in 2 weeks, and then at 2 months and 4 months and 6 months. It's because we're gonna, what we do every single visit, height and weight. I mean, you teenagers, height and weight, go into the doctor's pediatrician's office. We're monitoring that. And the reason is to make sure the child is growing the way they should. Is it not enough? Is it too much? Because either way could be a problem, and we need to do whatever intervention is needed, or any exams, you know, tests that needs to be done. As I said, when they're born, they're going to lose about 10% of their birth weight. You know, they come out pudgy from they've absorbed all this extracellular fluid from amniotic fluid, right? And then they lose it. And then about 2 weeks later, they've gained all that weight, and they're starting to gain, you know, about half an ounce a day of, you know, more weight on them. Again, as long as they're having wet diapers at 6 to 8, it's fine. And they're gaining weight, we know this child's gotten proper nutrition and they're tolerating the nutrition well. They also say breastfed babies should have some vitamin D. You know, vitamin D has to do with good muscle strength, right? And for the nerves also. As I said, it's an introduction. It doesn't matter, you know, where we start here, but what is our goal when we start to introduce food, cereals, fruits, vegetables? Why are we doing that? Well, we need to give more nutrition to the infant, and we're starting, if the baby is breastfed, to wean them from the breast, because they're drinking more and more and more and more. You should give the food before you give a milk when you're feeding an infant and when you're starting the foods on these children. Now, by 6 months, that's the 6 months, and some kids, you know, going to have no teeth at 6 months. But if by the book at 6 months you're starting with teeth, what we need to do is start cleaning the teeth. It could be a warm washcloth or just a soft toothbrush. No toothpaste now, nothing. Just get them clean. And then when they go to bed or for naps, do not prop the bottles. Don't have milk or juice in the beds, because that's those carbohydrates, those sugars, and it will rot the teeth. The pacifier, as I said, I've seen it back and forth, good, bad, but now there's evidence-based research that has proven that the pacifier works for so many good reasons. And it's that self-soother for nighttime. It gives them that feeling that they want when they're eating. There's a formula about teeth. They say number of months of age minus 6 should be the amount of teeth. As in, if they're 8 months old, you minus the 6, they should have 2 teeth. But as I said, not all kids are going to have that. I mean, my grandson that lived with me for a while and my 2 children, they never had teeth till 15 months. And all of a sudden they had 6. I mean, you could see them there, but they didn't have them. And yes, they did hurt. I had to give them some Tylenol. It hurt so bad. Infants should be sleeping 9 to 11 hours at night by 3 to 4 months. But breastfed babies tend to wake up more frequently because the breast milk goes away quicker. And that's why they usually will want more. You know, children do take naps, and, you know, this is controversial for students, even for me. Walker swings and playpens are not necessary, but I think we've all used them. I think we've all put them in the swing, you know, when they're fussy, just to give a motion for comforting. But according to the book, they don't really need it. These are all those immunizations that we give. And, you know, what do you need to know about them? Well, what you need to know is that hepatitis is at birth. You know, the diphtheria, tetanus, pertussis, polio are those 2, 4, and 6 months that we give. Measles, mumps, rubella is at 1 year that we give our first immunization. The pneumococcal also is something that we're going to be given, you know, at the 2, 4, 6 months. We'll give influenza shots at 6 months old to these children. And remember, varicella is a live vaccine. When don't you give live vaccines to anybody, any age?
When they're sick.
During pregnancy.
Okay. When
Immunocompromised.
Immunocompromised is the word, or on steroids. Steroids also create you immunocompromised. That's a question I've seen in med-surg, and I've seen it both in peds. So very good. Colic. I think a colicky baby is so difficult for those parents because no matter what you do, these children are cry. They've given them medicine, they've changed formulas, they've done so many things, but they do outgrow it, you know, by about 5 months old. So, but it is difficult. Can you imagine not being able to rest for 4 or 5 months of the baby's first life? You know, you've wanted this baby, and this baby, all they do is cry. It's difficult. It's very, very difficult. And I think as nurses, you need to recognize that. You know, you get a child in, they say, oh, he's so colicky, I never sleep. You know, just to say, wow, but you're doing a good job. It's going to be done soon. So good job, because sometimes you just want to shake them hard. And that's sometimes where you get into the abuse. Failure to thrive, again, growth failure. How do we know that's happened? Well, height and weight every visit, right? If they're not getting where they should be, there's a reason why. And it needs to be looked at carefully, because if they're not gaining weight, they're not getting proper nutrition, and everything's going to be delayed. Cognition, gross motor, fine motor skills, all of those things are going to be delayed. So finding out the reason why their failure to thrive and getting that care for that child is very, very important. Some of the conditions that we see, positional plagiocephaly, which means we call them toaster heads or flat heads, because they're sometimes the premature infants are born and we'll turn them from side to side, you know, and trying to, you know, make sure that their body doesn't get any sores. It's because they're on monitors. So we watch them, and sometimes the sides of the heads get flat. Now, one of the things about newborns and infants, their bones are still soft and malleable. And that's why a full-term infant brought home, yes, back to sleep at night, prevention of SIDS death, right? The back of the head can get flat. So what do we suggest? Well, put them on their bellies, tummy time, when they're wide awake and alert. And just those little here and there that you do helps that head really round out. I know I did see it quite a bit because with my kids, many years ago, we didn't know about SIDS. So my kids all slept on their bellies. Who knew better, right? But my grandson, my daughter, really put him on his back. And he did get that flat head in the back, and we were concerned. And the pediatrician says, do the tummy time and he'll be all right. And today he's got a perfectly round head, not a problem. I think diaper rash, diaper dermatitis. If a baby is full of a diaper rash like that, they're going to be in pain. They're going to be miserable. They're not going to eat. They're not going to sleep properly, are they? So we need to treat it. There's many different things we can do. We could leave it open. Just every time they stool, just warm water and soap and get, the stool burns those rashes, or urine and keep it clean. If it's a yeasty type, there's medication depending on what it is, okay, to try to clear it. All of my kids were all allergic to Pampers. Didn't like them. Put one Pamper on and you'd see the red rash there. So they had to have different sort of diapers. So knowing that and telling parents, did you change diapers when this happened? It might alert them to what they can't do, okay? Because this is what we do in peds. Teach, 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 teach. It's all about making sure parents are taking good care of their kids. Remember, it's family-centered care. And a lot of times, infants are born with this crusty sort of dandruff head, and it's very difficult. You've got this beautiful girl, you want to put a bow in, but you've got this, cradle cap going on. How do you treat cradle cap? It's called seborrheic dermatitis. What we'll do is you're going to bathe the kid normally. You're going to use a mild soap, but when you're done, maybe some mineral oil and a fine-tooth comb, just very gently. It's not going to disappear in a day, but over time it will go away. So I mentioned SIDS death, about sleeping on their back at night. There's been really a lot of research done on this. At the area hospital where I worked, I know back in the 90s, at the end of the 90s, they were doing these studies on back to sleep, it was called, which means having your children, especially those premature, which are high risk, put on their back in order to sleep well and, prevent SIDS death. So what are the risk factors for SIDS? Well, it is ethnicity, and males are more than females. We know that they should be on their back, not their tummy. Smoke in the air is big, getting too hot. If you've had an upper respiratory, you've clogged your nose, your mouth, of course, that could cause it. Breastfeeding helps it. So formula-fed baby are more apt to SIDS death than breastfed. Poor socioeconomic conditions could be, overheating or too cold, not enough nutrition, many different things. No or late immunizations, air pollutions, cot mattresses, objects in their beds. I used to have those cute little bumper pads. Well, today they don't believe in them because the kids get their heads wrapped and they hang themselves on them. So all these things are those risk factors and should be really looked at. Now, ALT, or apparent life-threatening event, is what they call an aborted or a near-miss SIDS. This is when you hear a parent come into the emergency room, doctor's office, urgent care, they're saying, my baby all of a sudden choked, held his breath, and he turned blue. And I had to turn him over and pat him on his back for him to start breathing. It could have been reflux. We don't know, but we consider it an ALT. It's a near-miss SIDS event. So these children are brought into the hospital. We look at neurologically and GI, what's going on with these children, and they're sent home with a monitor. And this monitor is a strap it on when they're sleeping. It puts out this squelch that is ear shattering. There's alarm set on it, and it will help, number one, try to jar the infant awake, and of course, get the parents in there to check the child. And it's just a little Velcro strap, very easy to use. So, question, Letitia is a breastfed infant being seen in the clinic for her 6-month checkup. Her mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention? Well, is it wrong to suck her thumb at 6 months? How do infants
It's-
explore the world?
It's C.
Sí.
Absolutely. They're put everything in their mouth, right? This is the way that they explore the world, and this is how they soothe themselves, through their mouths. It's absolutely normal. All right, so let's go into some theorists and let's go from there. So, infants, Erickson. The first stage is trust versus mistrust. And what does it mean? Well, an infant's put down to sleep, they go to sleep, mom leaves, and all of a sudden they cry. And mom goes, oh, let me go get them. They go pick them up, change his diaper, burp them, feed them, hold them, whatever they want. That's trust. They know if they call mom, something's going to happen. Somebody's going to come get me. Mistrust is when that child frequently does not get their needs met, which means nobody picks them up and lets them cry. And it gets to the point where they don't even cry because nobody's going to come get them anyway. And that's severe mistrust when they're not crying anymore, okay? So trust, needs are met. Mistrust, they're not getting what they need. Now, Piaget, we're talking sensory and motor. This is your infants. Sensory and motor is all about texture, sensing things. It's about oral, the mouth, and movement, as in a rattle. They finally get that voluntary grasp. They shake it, they hear it. So, oh, is that great? And then they put it in their mouth because they explore the world that way. It's all sensory and motor, okay? Now, 1 to 4 months is what we call primary circular reactions at 4 months. Now, all of a sudden, the kid, by accident, sticks their finger, their thumb in their mouth, and like, oh, I like this. So they do it again. They figure out, nobody showed them, all of a sudden it was there, and they did it. Then it goes up into 4 to 8 months, secondary circular reactions. And this is where you can look at a child, and you could like stick your tongue out and move it, and all of a sudden they're doing it with you. Or you, and the baby tries to imitate these sounds. This is secondary circular reactions. So they also will, look around. They'll reach for their rattles, they'll grasp it, and they'll shake it. It's all a part of the same thing. They figured out that works. Body image. You ever see a little child sit there in front of a mirror, even like the shadow on a glass, and see themselves and try to touch it and lick themselves and figure it out? Well, they're starting to figure out that they've got a body there. Like, who is that? It's part, again, of exploring the world. We've talked about object permanence last week. Object permanence is when you have a toy there and the baby's playing with it and it gets behind another toy, for say. Let's say the rattle went behind the teddy bear that's there. So the infant wants it. And they'll go somehow wiggle them way around and they'll grab the toy. Because even though it's not in sight, they still know that it's there. Social development. Well, infants know who their caregiver are. Even if they're infants, they're very smart. Somewhere, it gets to that point where, parents need to, whether put them in daycare or have a babysitter or go into the doctors, right? That somebody else has to hold their child. Well, they don't want that. So you'll see the infant turn back towards the parent like, no, don't let them take me, right? And that's separation anxiety. Then by 6 months, they'll again, being held by mom, they're going to look away because they don't want to see them there, okay? And then all of a sudden they're like starting to get curious about 9 months. It becomes less of a thing because they know they're going to come back to mom. But initially, this person can't take me.
I have a question regarding that. If you just go back to the slide. So if the baby's crying and because someone is going to take them, and going back to like the trust and mistrust thing, is it a bad thing if you give the baby, like, let's say the baby doesn't want to go, let's say it's the doctor and you're at the doctor's office and the doctor needs to take the baby and the baby just wants you, is that going to create that mistrust versus
Not a one incident, not a one incident. It's a really good question. Not in a one incident. Furthermore, the parent never leaves. The parent's still going to be there at that time. How about if you have to put them to daycare? You know, they're going to start to learn. Yes, there's going to have that anxiety. There's many children who always cry when you leave them at the daycare. And you'll hear parents say, it just ripped my heart out because they were crying and I didn't want to leave them, but I have to go to work, right? Now, does it deal with trust versus mistrust? They'll end up knowing that's their routine. They'll end up understanding it because their needs are met at home. All right. Language development. Well, what's the first thing a baby does when they come out? They cry, right? And then after they keep going, you hear them cooing. All of a sudden, and they're talking to you. They hear their voice. And again, once they hear their voice and they like it, they're going to continue. And all of a sudden, you're going to hear the baby in the crib by themselves or on the floor just playing with themselves and talking. Again, we know play is important. Again, it's a time of parents and mothers and fathers and their child making their bond and bonding over that playing and showing them things and talking, etc. And there are different kids. They're all different. You've heard parents say that, you know, my first kid was really hard, but my second kid was easy, or the other way around. They're all different. You don't know. You can't predict. And there is, you know, a questionnaire if it becomes more of an issue that can be done. There's questionnaires on everything in every place. So toddlers, as I said, these are my dive bomb kids. These are children with no fear and they explore the world like crazy. It is ages 1 to 3. Okay. And I love this saying. Having a 2-year-old is like having a blender without a lid because they're everywhere all at once. And they're very difficult to keep up with because you just want to protect them from any sort of dangers. It is the no, 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 me, egocentrical. It's all about me, okay? They don't want nobody else, and they're moody as moody can be. This is part of having a toddler. Now, we gained a lot of weight and height when they were infants. It slows down now. So let's say that 7-pound kid is 21 pounds at 1 year old. They're only going to gain 4 to 6 pounds every year of their toddlers. So, but even some kids don't even gain that much. They say birth weight should be quadrupled by about 2.5 years old. Their height should get taller. And now we're starting to see their legs are getting longer. When they're born, they have big bodies and shorter legs. And all of a sudden now their legs are getting longer, okay? They're getting, you know, going to be more apt and they're going to be less clumsy because of these legs getting longer. Again, head circumference equals 2 or it's less than their chest. And by age 2, this is going to be half of an adult child's an adult height. So if your kid is, you know, 3 feet tall, they'll be 6 foot, right? And it really correlates. Again, their systems are maturing. They're getting all of the infections. As I said, they're swapping spit everywhere. Go to the grocery store. What's the first thing your kid does? It'll suck on the handle of the grocery cart, right? Unless you have one of those little things over it or you've sprayed it with an antiseptic. Daycare, they're always somebody else's toy. And what happens? Chronic upper respiratories, ear infections, tonsillitis, because they explore the world through their mouth. So this is where those infections are. They're going to start with their control of their urine and their stool and potty training. You know, the stool is easier to control actually than the urine. They say if the urine they can hold for 2 hours, that's when they're ready to potty train, is what some of the research has said. Their gross and fine motor gets more coordinated. They're less clumsy, as I said. They're using both hands now. In fact, are they right-handed or left-handed? I don't know. They use both. They are going to be throwing a ball. Now, I mean, it may just be right down to the floor, but they're going to be throwing the ball. Their eyesight, remember I told you that binocularity, no depth control, and they don't see it? Well, now they're getting there. It's not completely there yet, but it's better depth perception. And they're going from hardly any motor coordination, and they're going to get better as it goes on. But again, they are uncoordinated and they are going to fall when they, you know, try to climb up the back of couches or up dressers or whatever. Their hearing, smell, and taste develop. You know, infants eat. If you've ever tasted formula or cereals or the foods, they really are bland and ugh, right? And the infants just eat it up because they think it's so great. Well, because their taste is starting to develop, they're going to start to get picky. They're going to be almost in, you know, type of anorexia. They call it physiologic anorexia of the toddler. They only are going to eat the little things they want to eat, but they're not gaining that much weight, so they don't really need as much food, okay? And they're exploring the world through everything. I think that toddlers, after they're done eating, all of a sudden everything's smushed all over the high chair, it's in their hair, it's everywhere. It's actually a good thing because they are exploring the world. So Erikson and the toddler. Well, they're no, me, mine, and moody, for sure. They love routine. They want bedtime, nap time, lunchtime, dinner time, the same. And they really prefer the same type of foods, you know, all the time that they like, okay? Which means a big difference when you're in a hospital. Find out so that we can have those things there. And as I said, this id, ego, super ego, no, it's me. I don't care about nobody else. That's Erikson. Now, Piaget, what they're doing is they're starting to go and learn more. They're starting to figure out why things happen. You know, they are taking trucks and they're putting dolls in them and rolling them and hearing them roll. And they're trying to see that if I hook this one to this one, I can pull both of them around. It's learning by experimentation. And it really, and you're going to hear that as they get older in the toddlers, you're going to hear them start to talk to themselves in their own language about, you know, the thing is going up and zooming around and whatnot. They are starting to be able to see new situations, but they don't like it. They want their same routine. So again, you'll see negativism, you want that ritual, and as shame and doubt, that is what Erikson says. Now, what does shame and doubt mean? Well, when you're talking about shame and doubt, this is when a parent doesn't let a child do something. If they're doing something that could cause them to be hurt, they tell them, no, don't do that. Don't let them touch that. They feel shame about that because I must be doing something wrong, right? The autonomy is when they can sit there or pull their toys out of their toy box and play, and you're encouraging them and it's fun. That doubt comes into, mommy, don't let me do it. Sometimes they need to learn if they jump from the couch, try to jump over, let's say, to a hassock or a soft coffee table, and they miss and they fall and they hurt themselves. Sometimes they need to learn that, as long as it isn't a big injury, right? Because they tried at least. So they experimented and they're never going to do it again, most likely. Another thing that goes on with these children is now doing things that feel good. Of course, everything in the mouth, that's always part of it. As they get older, you could see shaking the rattle, that's your infants. And then get up to toddler. Put them in a high chair, you have a sippy cup. Mommy goes to the kitchen to do something. Mommy's not there. Mommy wants a kid. The kid takes the cup and throws it on the floor because they know mommy's going to come and get that cup off the floor and say, don't do that again, right? They made the response. They know what's going to get mommy back over. And I think that for a 12 to 18-month-old, they're smart. They're very smart. Now, another thing going on forward is looking at Piaget and going into the higher up things. I'm going to talk more about the older kids in the slides next week. I've already made sure that they're good. So this slide, forget about. It's just out of the area. I wanted you to know your infants now and now your toddlers. Okay, toddlers. At this age, they're starting to put their hands in their diapers and start to feel their whatever's there. And the one thing about it is, as parents, we should say, you know, you don't need to touch your penis here. If you want to touch your penis, go in the bathroom, go somewhere else. And you should use the real names, a penis and a vagina. But of course, that's always up to what the parent wants to do. But as long as there is a name that, you know, the masses will understand, because remember, they're not always with you all the time. So they will be touching, exploring, feeling. It feels good. They don't do anything with it yet, but just as a parent say, okay, go to your room to do that because we have company here. That's a private thing you do by yourself, right? They're starting to understand males and females now, and they're going to play house, right? They're going to say, I'll be the mommy and you be the daddy. And, you know, tea parties and whatever else is going to go on. They know that other people are not their mom and dad. They know who their family is. They know who their significant others are. And there are things that kids like. They have their toys. My grandson had a blanket, and he had what we called Mr. Puppy. And Mr. Puppy was a zebra. No, it was a giraffe. A tall-necked giraffe, one of those little stuffies, and we called it Mr. Puppy. Why? I'm not sure. This is something that gave him comfort. And that's that transitional object, you know, giving him comfort so that here, mommy doesn't have to fall asleep in bed with the child. Here's Mr. Puppy. Good night. Their language is getting more and more and more. We're going to be able to talk more as we get older, you know, as you know, we start at crying and cooing, and we're saying mommy, daddy, or dada, mama by a year old, hopefully nana for me, right? And then as they get to be toddlers, they're going to start to say 2, 3, 4-word sentences. It may not be something you understand, but children have a way of letting you know. They are also going to start with being able to put their clothes on. I mean, I think the off is easier than the on. Children taking their diapers off, taking off their shorts, well, shirts are harder, but usually pants, diapers, they'll take off. But they're going to want now independence. Remember, me, mine. I want to do it. So they're going to start to try to feed themselves, spoon upside down, food everywhere, but remember, it's a process, it's a learning curve. So let them play, let them try to dress themselves and undress themselves. And I tell you, it takes patience when you're in a hurry. When you want to hurry up and get dressed and go out, or it's time, let me get you to bed because I got to go study, I got a test tomorrow. I know it's difficult, but giving that time and opportunity is important. Also, as the kids get 2, 3 years old, they aren't going to understand other people. I'll give you an example. Grandson was 2 years old, and I was having a flare from my rheumatoid arthritis, and my knee, I was packed in ice, and I couldn't get up or something. And I said, I'm sorry, Christian, I can't get up. My knee's really, really hurting today. I've got ice on it. And he came over and he kissed my knee. All better. So these kids at young age really do understand other people, which I didn't think about, but they do. Again, play, there's all sorts of play. This is physical, psychological, social development. They play alone, together, doing the same thing, working towards a goal. All of these things are part of their intellectual growth and how to get along with other people, right? Making sure they have the toys they need. And then, of course, the different sorts of play. I mean, parallel play is 2 kids, 6 kids in the same room, all playing by themselves next to each other. And it could be with the same toys, different toys, it don't matter. And they can even imitate what other kids are doing. And then tactile is what things touch like. Think about going to the beach, sand, that's a nice texture, right? As I said, toilet training, they've got to be able to hold their urine for 2 hours. It's part of the readiness. And all kids are different with potty training. I think the one thing, believe it or not, that helped me with my grandson is the picture of this boy backwards on the toilet seat. I saved a lot of urine squirting over the edge and onto the floor because it would point down here and he would get the urine inside, and he thought that was neat sitting on it backwards. So it does work. Sibling rivalry will always be. You love him more than me, as you're going to hear get older. As a toddler, they may not express it, but they're going to act out. You know, they're going to do something to get your attention if you're paying attention to the other brother or sister. What I do with sibling rivalry, especially if there's a new child coming along, have the older child be involved. Can you get me a diaper, please? Or could you go get me the wipes? Or I need a blanket, or here, put this in the garbage. And then they feel like they're a part of it. And then maybe, if you can, have them help you feed the baby as they get older, or play with the baby and teach them. As long as they're given those things, that rivalry is going to be less. Temper tantrums, as I said, toddlers are moody, you know, and what happens is they want something, they want it now, or they don't want to go to bed. Probably the biggest time. Putting a kid to bed can be the most difficult thing. You know, they want mommy to come in or daddy to come in. They want a book read, and maybe another book. And oh, I have to go to the bathroom. I need a glass of water. And it could be all of these things. And then, you know, just crying, no, I don't want to go, la, la, la. And again, it's difficult, but you, again, try to be consistent. As I said, it's no, 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 me do, mine, mine, mine. And then you see a kid who hasn't, you know, let's say by 3 years old or 2.5, they're potty trained. And all of a sudden they start, you know, not being potty trained, you know, having accidents. They could be stressed. It could be you just moved to another house, or you have a new daddy, or grandma's not there, or whatever. They feel stress, and they will show it by regressing, sucking their thumb again, or finding a pacifier. Those things, this is what children do, that are giving you those things. So again, here's some type of questions for you, and the answers are there below, so you can check them out. Social development milestones is play, right? So by age 1, one-word sentences, and by 2, multi-words. And they should be able to start to feed, play, and dress or undress themselves. We know that play is important, and there are different sorts of play. And car seats. You know that top picture? I remember my brother being in that back in 1950 something. I remember being maybe 4 or 5 years old. And I remember that car seat, and they didn't have middle. There was just one big long seat in the front, and it would be me, my brother, my mom and dad in the front seat. We didn't know about, sitting in the back seat, right? Rear facing. Oh my goodness, we had no clue. So car seats have changed. And because of that, make sure you look at expirations on your car seats. They should be rear facing to the age of 2. They also say in pounds of 30, but remember, not all kids weigh 30 pounds by the age of 2. So they base it upon muscle strength and muscle dexterity. And as long as their growth and development is up to where it should be at age 2, you can turn that car seat around. But there's a lot of different questions. Never use an old car seat. Never buy it from a garage sale if you don't know what it is. You can borrow it from somebody that that was a new seat that they're not using. Of course, new ones are always good, but be very careful. And what's great about many different children's hospitals, they do have car seat Saturdays where you could go over, sometimes get a car seat if you can't afford one, and that happens a lot. Or they show you how to put it into the car so that it is safe for that child. And now preschooler, ages 3 to 5. So preschoolers, ages 3 to 5. This is now stopping the infant babyish sort of things and now getting them into more formalized routines of learning for like school. We are now getting them ready for school. We are showing them that coloring, the colors in certain places. We're starting to show them the colors or letters of the alphabet, showing them numbers, reading books to them, and being excited about going to school and preschool. Most kids go, 3 or 4 preschool, and they're not just going for daycare to play. Many of them do have little lessons that they do learn. We know that going to school, and some children have never been in daycare. Some children go directly from the home, not many today, but they go right into school, and now they are there for 6 hours or whatever amount of time. And this is a separation away from the family. So they have to learn how to work with other adults. They have to be able to be social with other children, and they're going to have to listen to the rules. They have to understand. So that increased attention span and memory. So it is a big deal as we get into preschoolers and getting them ready for their kindergarten. So again, everything is slower. The weight, their height is the way it's growing slows down. And then, of course, their vital signs are starting to come down a little bit more, the numbers. Gross motor, get up and go, go, go. They're walking, running, climbing, and jumping now. Fine motor, this is now they can dress themselves with the right way, not inside backward. Well, sometimes the younger kids, it's backwards. I know I've gone out several times with my grandson, and I'm like, your pants are on backwards. Why is that? The tag is in the back, dude. And he goes, oops. So it's because he's in a rush, not because he doesn't know. And I think that was part of his thing. Now when they're coloring, they're getting inside the lines, and it looks, more of a picture instead of just scribble all over the place. As they get up to age 4, you're going to see fine motor. Now they can button a button on their shirt. Okay, one of the things they can do. So Erickson, this is all about sense of initiative. All right. And what they're starting to do is understand what they need to do, what has to be done in order to function in wherever they are. They also are afraid that if they're not understanding or doing what somebody wants them to do, that somebody's going to yell, that guilt, that anxiety, that fear. And they also don't want to do wrong things. Like They don't want to color on the wall in your house because that is bad. And they know there's going to be a consequence. You know, it's called super ego. Somebody better than yourselves looking at you saying, you did that wrong. And they don't want to be wrong. And of course, again, wrong moral development, part of Kohlberg also. They know there's good, they know there's bad, know there's right, they know there's wrong, and they know there is a consequence for either. So again, they're still getting ready for school because they have to learn. Most kids are in kindergarten by age 5 or 6, depending on when they were born, of course. So again, we have to prepare them to be there. Sometimes putting them in sports activities, you know, putting them in a gym like a jamboree thing at the, you know, for gymnastics, the library, sitting there doing reading groups, whatever. Put them in places where they have to sit and learn to be with other people will help them get into kindergarten and work as, you know, a whole group of children. Always that positive attitude of learning and read to that child every single day. I know my daughter, she's an amazing woman, that this child knew the planets and still today from the sun out to Pluto and what each of them does because she read this one book and still reads it, you know, several times a week. And he will sit there now and look at the book and know what the words say. And because of that reading, this kid is far advanced in his letters and his alphabet. Now they may be backwards, crooked, you know, 5 instead of the loop this way, it's the other way. But because he's tries to go too quickly, but he understands it because, you know, sometimes she'd read him 3, 4 books and it was their time together. It's one time that you do have, and it does help the child a lot. So they're being aware now, as in Piaget says, they're starting to be aware of other people. They're hard to understand that not everybody thinks the way that they do. They know that, you know, some children are different in the way they dress, the way they look. They're starting to understand that now. They're able to speak better. They are understanding concept of time, not by a clock. You know, concept of time is after we wake up in the morning, we're going to go on a car ride, go to Disney World. After lunch, we are going to go to the grocery store. They don't know at 1 o'clock. They don't know 9 o'clock. They have no clue what that means. It's late. It's almost, you're going to stay at Nana's house 2 morning times. So they know when the sun comes up 2 times, that's how long they're going to be at Nana's house. And that's what my grandson understood. So that is that concept of time. They're in that magical thinking, making up their own little things, talking to themselves, playing with their toys. It's just part of it. I mean, I love to sit there, not so they'd see me, but to listen what's going on. Again, Kohlberg, they know right, they know wrong, and they know that there's a consequence or punishment for it. And they don't want to do wrong because they don't want to be punished, okay? But as they get older in here, they're going to question you why you punish them. So they want to make sure they're getting the right consequence for their action. Sexuality, again, they girls like their fathers and boys like their mothers. It's just what they do. They're closer to them. They're starting not to let you see them naked. They're going to close the bathroom door when they're going to bathroom. They're in the shower or the bathtub. They don't want you to come look at them or somebody else that's not mommy to go in there. More, you know, they want their shirt on. They don't want to walk around in underwear. They're getting more modest, okay? Again, they're still playing with their privates. It's a little bit more than before, but again, say, okay, you know, stop playing with your penis. If you want to play, go in your room. We don't need to watch that. And that, I've said it, I can't even tell you how many times, you know, with this little boy that I have around this house a lot. And they're going to be asking, especially if mommy gets pregnant, how did that happen? Where did the baby come from? always make sure you say, so what do you think happens? Okay, so don't try to give them an in depth, because remember, kids talk, you know, at school, in kindergarten, and they're going to be talking things like this, and there's going to be a lot of misinformation. So find out what they know first. Again, children that are toddlers need a ritual. Preschoolers adjust to this a lot better, as in it's easier to take a preschooler on vacation than it is a toddler. Toddlers don't tolerate no nap times, different bedtimes, different food, different place, different house, different. Preschoolers do tolerate it better, okay? They try to please you, and they want to dress themselves. They want to dress cool and see the red and the red matches, and look, so do the underwear. You know, they think they're cool people, and it's part of what they are. They also have the values of the family, and that could be the manners, you know, please and thank you, making sure they take their dish, put it on the kitchen counter when they're done. These are all those sort of values and standards that come from the family or their culture. So they're understanding that a lot. But again, they're gonna challenge your code of conduct. But you said I could do this, and daddy said I could do that, and Nana said this, and they're gonna be there trying to question you. And again, it's hard, but keep everybody on the same page, doing the same, you know, this is what you're gonna do. The different sort of plays, you know, we've talked about these last week, but let's go over these again. So parallel, if they play next to each other, that's from a previous slide. Associative, they're sitting there playing with 2 kids, 5 kids, all with the same toys, but there's no rules. But they're all playing together. Let's say making a house or making a, you know, a little city, whatever it is. And that is associative play. There's no rules, and there's no winner. There's no outcome. Imitative, they're going to do what another kid is doing. Imaginative, very, very normal for a preschooler to have an imaginary playmate. Ever see a preschooler sit there and play with a toy and they're talking like they're talking to someone else? Probably it's what they have as an imaginary playmate. They really don't even understand they have one. Now, if they're 8-year-olds have an imaginary playmate, this could be schizophrenia or something, but a preschooler, it's definitely okay. Dramatic play is when you act out things. We use this a lot in the medical to find out sometimes what things happen. And mutual play, again, playing together. Fears. This is where they hate the dark, do not want to be left alone, and there are ghosts and somebody's going to come and get me. And this goes throughout the preschooler times. They're afraid of large dogs, even small dogs, you know, especially if they've had an experience. They're afraid that something's going to happen to their penis if you wash it or touch it, or their vagina, or something's going to happen. And they're also afraid of people associated with pain, which means you, the nurse, coming at them for another immunization or injection, right? Again, things that I've already said, sex education, number 1, find out what they know. And you're starting to see masturbation about age 4. They're going to be start touching and saying, oh, it feels all right, but they don't know what they're doing. Again, tell them to go to their room. You don't need to see this. That's their own special stuff. And they do say to use the correct anatomical words, but again, it's your choice. And be honest. Now, within what do they know? Be honest about it, because they're going to ask you 2 years later the same thing, but you said it was this. So, and that builds that trust. And again, the fear, same thing. So time for a Kahoots. You ready? A lot of different stuff, huh?
Can we take like a 5-minute break?
Sure. What do you want to do? Go get something?
Yeah, I need to grab some water or something.
Go ahead. We'll take a couple minutes and set up. Come on back when you're ready, and we'll keep going. I know it's hard to keep going, but anytime you need more time, you need to do, get up, go to the bathroom, get something to eat, get a glass of water, I totally understand. Because if I had to, yeah, I'd have to stop the class. But let's take a couple more minutes with just this setup, and then we'll get going. If you need something, please go grab it.
Professor, how do you join again?
Go to www.kahoot.it. It's okay.
I got it.
Not a problem. Remember, there's no silly questions. Do you like your funny faces that this Kahoots gives you? All right, we're going to get going, okay? I believe there's 59 of these, and then we have a quiz. Week 2. It goes by quick. Multi-select. Types of play considered to be sense pleasure play. Remember, sense is all about textures, right? And what do? You play in sand, you're touching that sort of different sort of, it's the sand, finger painting, using the hands, and then of course smushing mashed potatoes around. So playing checkers is just a game. It's cooperative play. There's an outcome, okay? The nurse notices with white patches in the mouth of an infant that cannot be removed with a tongue blade. Intervention. Sorry, I spelt that wrong. For some reason, I've been dyslexic these days and miss letters and switch them. So white patches in the mouth is probably a yeast infection, all right? It's thrush. If you can't remove it, it means it's not just milk that's sitting there. It's probably an infection and it's going to need medication. They use nystatin, it's little liquid. They put little on each side of the mouth and treat it that way. Just like powder is used for the diaper area, it is a yeast. Hongo, as the Spanish say, or it's also called thrush. And the thing is not being able to remove is the key thing there. What type of play is considered cooperative play? So cooperative play is, again, playing together, 2 or 4 or 6 kids together, but there is a goal in the end. 2 kids together is checkers, but they could play something else that this is what you do to have to win. There's a goal, something to achieve to win the game. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning you think of morality, what do you think of? And this is that there's good and there's bad and there's a consequence for each. And they know the good is a praise and the bad is probably a timeout or punishment or something taken away. Good. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? So you got to have a kid, let's say they have to come in, get an IV started, and go and have a CAT scan or an MRI. We need to teach them, right? On their level, get on their level, on their developmental level, and we're going to have to explain it to them. And we can explain that better if we have a doll and maybe show them the equipment and that it doesn't hurt. Because once they get there and they hear the ding, ding, bang, bang, like of an MRI, they could get scared, right? But if now we had a doll go in there and explain it to them, it's going to be better. Kids, especially preschoolers, will listen. A multi-select. What are some findings from a pediatric physical assessment? When you talk about assessment, it's usually history and physical, right? I just want physical. Trying to, you at this point, teach you how to read a question for what it's really looking for. So stuff that you can touch and see, growth, body systems, temperature, those are all physical. The medical history is a history. Before performing a physical assessment on a toddler, the nurse should do what? To encourage cooperation. So you're going to first use minimal touch. You get down on their level, right? You are going to, try to get a rapport, use minimal touch, and then let them play with the equipment. Then you could get whatever you want done, okay? It's a tricky question, I know. What would you suspect if you note that an infant's chin is quivering, the fists are clenched, and they're inconsolable? So probably pain, right? This is telling you that face, that flack, the facial, the legs, the activity, the crying, that's all in the description of pain. And they do the little chin goes and they get crinkle face and you want to cry with them. A multi-select. Erickson describes infants versus trust versus mistrust. What does trust mean? So they feel secure. They're happier because all their needs are going to be met. If they have to cry too long to get someone's attention, that is mistrust. A 3-year-old is having an outpatient procedure. How would you help the child be less fearful? Yep, we're going to use that doll. Again, get on their developmental level, break open by saying, you know, I love Batman like your shirt too. Have a little bit rapport, and then a doll, and then let them try it on you if they need to. And it does work, and it saves time in the long run. Another multi-select. You need to do an assessment on an infant, and you walk into the room and the infant is asleep in the mother's arms. What do? You need to do an assessment. So we know that if an infant is asleep, we're going to be able to listen to their heart and breath sounds because they're not cooing and they're not moving around, and it's a better assessment. Remember, there is no head to toe in infants. It's what you can do when you can do it. And when they're quiet, it is the best time to do these things, listening to their heart and lungs. When do you switch formula to whole milk? So at 1 year old, you can switch the formula to whole milk very safely. There are people just, want to go continue on breast milk, that's fine, but whole milk, and they need the fat, okay? They need those extra calories and they need the fat because their bodies are growing so quickly. Another multi-select. When teaching about car seats for a newborn infant, so gently use car seat from a friend. It's going to be rear facing back seat or a new car seat, but you don't want anything that's older because the safety features have been made better as the newer ones. Another multi-select. When and how do you introduce solid foods to infants? That's a picture of what my son used to look like after dinner every single night. That's why bath time was after dinner. So it's at 6 months, one food at a time, and we wait 4 to 7 days in between before we add the next item to make sure there's no allergies, because children do have allergies. You want to catch them before they become bad allergies. Before assessing a 4-year-old child, what techniques would you use to approach this child? So again, break open the ice, tell them you like their shirt. They've got cute freckles, beautiful eyes, those lidded tennis sneakers. Do they run fast? Whatever it is, they're going to feel more comfortable with you because now you're on their level. Again, sit down next to them. Don't be towering over them. What technique can be used to examine a toddler? A toddler, ages 1 to 3. When you've already got on their developmental level, you've already broken on the ice, you're already sitting down next to them. Now, how do you examine a kid? You're going to use play. Let's say they're here with an earache. Tell me which ear hurts, or do you know where your nose is? Did you find out how you breathe? Where's your lungs? I mean, make fun out of it, make it play, and they work really well with you. When assessing a healthy child's lymph nodes, what should you expect? And they could be in the neck, armpits, the groins are the big places that we look for. What do you expect if the kid's not sick? You shouldn't feel anything. They shouldn't be there. The only time lymph nodes will get bigger is when they have an infection, okay? So you feel lymph nodes, the kid's getting sick. Which Erickson stages of developmental levels would be used on a toddler? Remember, this is the one where we, as parents, try to stop the kids from doing things they shouldn't do. And that promotes them not feeling good. Autonomy versus shame and doubt. Remember, autonomy is me, mine, mine, I do, right? That's the autonomy. And that shame and doubt is mom don't let me do it. So I don't get it. I don't understand it. I want to do it. Mine, me. What pain scale would you use on a 3-year-old child? This is a preschooler. What pain scale is now used on preschool? And that's faces. FLAC is for your infants and toddlers. Once they become preschooler, ages 3, it is the faces scale. And then at age 8 is numeric, according to the book. I'll multi-select. Erickson's autonomy versus shame and doubt is used to describe toddlers. And what does this mean? Did he know the answer? Wendy, did he know the answer? I see him back there trying. Anyway, as I said, when it's shame versus doubt, now that shame and doubt, the autonomy is doing what they want, exploring the world the way they do. The shame and doubt was mom says, no, you can't do that. They don't want them to hurt themselves, so they stop them from doing it. And as I said, sometimes we need to let them do it so they experience it, so that then they like, okay, well, I tried, but yeah, no, I'm not doing that again. I hurt myself. Or yeah, it's not what I wanted to do anyway. A 2-year-old is playing with mud and dirt. What type of play is this? I was the 2-year-old girl who used to always play with the mud and dirt. But I had 6 brothers. And it's that sense pleasure. Excellent. Good job. And parent of an 18-month-old boy says that he says no to everything and has these really rapid mood swings. What do you tell this parent? Absolutely normal. This is all about the toddler. This is them. Egocentrical. They are me, I, me do. And they're moody and having temper tantrums. That is a toddler. What is descriptive of the preschooler's understanding of time? Preschooler, ages 3 to 5. What do they know about time? Again, they don't understand the clock. They do understand time by events. After lunch, we'll do this. When you wake up in the morning, after dinner, when it gets dark out, whatever, things they understand, that's how they do. It's not by the clock, and they understand those things very well. A 4-month-old infant's crying and shaking on their head. What feature of pain is this infant showing? They're shaking their head. Why are they? They're crying, they're grimacing, their legs are inconsolable, they're shaking their head. What does that mean? It's probably location. They're telling you probably earache, right? Sometimes the hand goes in the mouth, they're telling you the throat hurts, all right? They show you, even when they come up like this, they can tell you their abdomen hurts, their belly hurts when their arms and their legs come up and they push them together. They will show you where their pain is. You just got to look. A 1-month-old infant, back of their head is flat. What would you tell the mother? So this is normal because back to sleep, again, put them on tummy time when they're awake, wide awake and alert, and that will help the head because their skulls are still very soft and pliable, and they'll go back. Infants crawl before they walk. This pattern of growth and development is called what? They lift their heads, they roll over, they crawl, they creep, they walk. It goes in a certain way. What is that called? And it's called sequential trends. It happens in a sequence. Doesn't mean they don't skip one of those sequences, but they're moving forward within that sequence. How do you communicate with parents that do not speak the language that you know? So always use those telephone interpreters. Don't ever use a family member because they'll interpret the translation the way they understand. The telephone interpreters exactly how it is said, they interpret it for you. At what age would most children could understand under, over, on top of, beside, around of, all of those things? Go look for your sneakers underneath the couch. Go look on top of your dresser for your shirt that I set out. Go beside your bed and find your toy that you left, right? And this is another way that they're following simple commands, and that is going to be your 4-year-old. You can tell them to do stuff, simple commands, they'll get it done, and they understand those terminologies. Some kids do it before, but book says it's 4 years old. So I say, if you have kids, don't think about them. In terms of language and cognitive development, a 4-year-old child would be expected to do what? And they should be able to follow simple commands at this rate here. They don't understand people yet. They don't understand conservation of matter. That's school age. And abstract terms, oh, absolutely not yet. What pain scale would you use to assess the pain of a toddler? And that's the FLAC. That's the faces, that's the legs movement, activity, and crying consolability. That's toddler. At preschool, age 3, it becomes faces. A multi-select. What safety instructions would you teach the parents of a 6-month-old child? Well, safety depends on what they're able to do, right? So what would you be concerned about the most? So you want the car seat rear facing, you're going to cover those electric outlets, especially if they're crawling there. But I think most important of all is if they're on a couch or on a changing table, have them strapped in, they will roll off because they should be able to roll over by 6 months old. Good job. Multi-select. What are cognitive characteristics of a child ages 2 to 7 in the pre-operational stage? Remember, cognitive is all about the way they think. They don't know what other people think yet. They're extremely imaginative and creative. They're that magical thinking people, but they use objects to represent something else. Like they take a broom and they ride around, or put the arms out like an airplane and they fly around with their wings, right? That's all pre-operational. A nurse receives a phone call about her 6-week-old baby. He's crying a lot every day. What can she do? So a mom calls in, has a 6-week-old baby, and the baby's crying. What does she need to tell this parent to do? So this kid's crying. We can't assume it's colic, gas, or anything. We can't do that. That kid needs to be seen by the physician. It could be something else more serious, okay? There's times where you can give information over the phone. There's many times you cannot, especially on a 6-week-old. Multi-select. What should an infant be able to do at 9 months old? So they should be able to sit without support. Okay, that's the key thing. Voluntary the rattle, pull them on their feet and roll over. Very good. Yeah, that was tricky. It's without support. The first expected fine motor developmental milestone for an infant begins with the first thing they do, fine fingers. Always remember, when you see motor, is it fine or gross? Remember, fine, F fingers. Gross, get up and go, go, go. So they should be able, that's the reflex palmar grasp, and then it goes to palmar grasp, okay? And pincer is not so neat one to about 10 months old. A toddler's parent asks for the nurse for suggestions on dealing with temper tantrums. Kid falls down middle of the grocery store and just having a fit. Toddlers, remember, they are moody. They're going to do these things. What should you do? Leave them where they are, ignore it as long as they're not hurting themselves. Because if you pay attention to it, they know they get your attention by having a fit, okay? By having that temper tantrum. I know that's hard to do, but that's what you should do. A 2-year-old has difficulty in activities, sensory sensitivity, and only speaks one-word responses. How are you going to assess these behaviors? It's a 2-year-old, only one word at 2. They should have up to 4-word sentences, right? Something's not right. Sensory sensitivity. These are big, big red flags that are going off. And that is the modified checklist for autism. And we're going to go into that when we get into cognitive things that go on, disorders. But that's one thing at 2 that you might see. And, you know, we need that. If you're at a daycare, you see a kid like that, that kid needs to be checked. Parents are concerned her 8-month-old child's not developing like her older child. What's normal for 8 months? Sit alone unsupported, okay? Pull themselves to a sitting position, you know, from prone is 10 months. First steps, 12 months. Blocks in the container, 11 months. So knowing gross and fine motors are important things to understand. Which fine motor skill is expected of a 4-year-old? Remember, fine is fingers. It answers the question for you. If you read the question, fine F fingers. And that's button a shirt. Walking up the stairs could be their gross motor, and the skip and tie shoelaces. Those are more like 5- and 6-year-old kids. A multi-select. What gross motor skills should a 4-year-old be able to do? They should walk up the stairs and hop on 1 or 2 feet. Jumping rope is a 6-year-old, and tying shoelaces is a 5-year-old, okay? According to the book. RN doing developmental screening on a 10-month-old should expect which fine motor skills from an infant? Remember fine motors, F fingers? Trying to get you in the habit of thinking that way. What gross motor, fine motor, what is what? So that's more of a crude pincer, and then starting to put objects into a container. Remember, it finds up at 11 months, but they're starting to do those things. Frequent developmental assessments are important for which reason? I mean, why do we want to look? Do they turn over? Do they walk? Do they sit? Do they crawl? Why do we want to know those things? Do they have a grasp? Can they change hands? Why? It's because we can identify any delays and deficits, and we can start early intervention, and these kids catch up very quickly. A multi-select. An infant searches for her toy that is not in sight. What is this? It develops memory, it explores by themselves, but the overall name is, it's called object permanence, which is the exploration and the memory development. The natural physical sequence, developmental sequence that most child follow is what? as in physical development or gross motor development, same thing. And the first thing they do is lift their head, so the rest follows suit. Very good. Multi-select, which would alert the nurse to hold the digoxin on an infant she's caring for. Well, what have you learned about digoxin in pharmacology? What do you need to check before you give it? And what are the normal levels for digoxin? So heart rate of 90 is too low. Usually they say below 100, hold it. Digoxin level, what is it? 0.5 to 2 is okay. Potassium level, if you don't have a good potassium level, you cause dig toxicity, 3.5 to 5. Pulses have nothing to do with digoxin. In general, an infant should triple their birth weight at what months of age? They double at 6 months, triple at 1 year, 12 months. Very good. When an infant's toes spread, when the soles of the feet are stroked, this is called Despovinsky, just like adults. Rooting is when you stroke their cheek and they go for food, whether it be breast or bottle. Startle is when they jump when they hear a noise, or you hit the crib and you startle them. It's called startle reflex. And grasping is when you grasp a rattle. How can you prevent otitis media in infants? And yes, we can decrease how many incidences of otitis media they have by very simple things. And it's that smoke exposure. Frequent breastfeeding, you don't have to frequent, normal breastfeeding, okay? Prone after feeds, you're gonna put them on their back so that they can have that secretions go in their ears. And of course, we don't use Q-tips on anybody. So smoke, big thing, also has to do with SIDS too, right? When entering an infant's room, the door slams shut and the infant jerks and starts to cry. What is that reflex called? Now, I told you one of the names is startle. What's the other name for startle, right? We know what Babinski is, stroking of the foot. We know what rooting is, touch those little cheeks and they want, I want to eat. And it's called a Moro reflex. Very good. A 4-year-old's reluctant to take medicine. What intervention should the nurse take? You know, many 4-year-olds, they just don't want it. They don't like it. They've had bad experiences. And we call it a straightforward approach, okay? You never mix medicine with food or juice, because what if they don't eat all of it or drink all of it? They've lost medicine, or how much did they actually get? So would you like a liquid or you like a pill? Do you want it in a spoon or do you want it in a cup? That's it. Do you want the orange medicine or the red medicine? Straightforward, and they will be better at taking it. I'm not saying it always works, but that's what's suggested. Which intervention helps a hospitalized toddler feel a sense of control? Remember what toddlers are, and you know, how do they have control even at home? And it's that rituals, it's that routine. Excellent. A 3-month-old infant does not sleep through the night. What finding is most significant? A 3-month-old should be sleeping, long periods through the night. Why aren't they? Has a diaper rash. It hurts. They pee, they poop, it hurts, and it will stop sleep. One of the things to take care of is some protective emollient or something on it. And RN is assessing a 2.5-year-old toddler. What finding should be reported to the healthcare provider? And it's the head circumference and the chest circumference. The head needs to be less or equal to chest at that point. If not, find out why. Multi-select. What are the risk factors for SIDS? Sudden infant death syndrome. Risk factors. What can cause a SIDS death? And gender, males or more, secondhand smoke, recent viral illness, heat, stuff in the crib with them. Breastfeeding decreases the amount, so it is not a risk. It's actually a benefit for. What does the rooting reflex enable the infant to do? And that's you're stroking them there, and they want to eat. They want the bottle or they want the breast. A multi-select. A child's been admitted with profuse diarrhea for 2 days. What would you expect? You're losing a lot of diarrhea, stooling. What would you see? So potassium's going to be low. You're losing alkaline out of, with this stool. So you're going to be more acid. And that's all you'll see here. Hypernatremia, no. Maybe hypo. Metabolic alkalosis is for vomiting. That is not for diarrhea. Normal language skills for a 3-year-old child. This is your 4 words by a 3-year-old child. If they're not, find out why. So 1, 2 words, maybe they need speech therapy. An infant's unable to take breast or bottle for feedings. What is important to remember? Many premature infants, they're just too little to be able to suck, swallow, and breathe. So we need to put tube feedings in them, but they still have needs, and they have needs for that pacifier because it self-soothes. This is how they take care of themselves. It gives them comfort. So we were going to give them a pacifier. For any reason, you give them a pacifier if they can't eat. And what does an infant start to do at 3 months? 2-3 months. They should be able to roll over, and that their head's always going to be lifted up. They're going to be going from their back, from front to their back. That's the easier. Back to front is harder after that. Remember, by 6 months old, they should be able to do both. All right, let's see how we did. We're gonna get ready for the quiz. It's gonna be in Canvas. You're gonna go to your modules and click it through there. Wendy, good job. Deanna, and who did it this week? Brittany, good job, Brittany. Number 4, Ganna and Elise, good job. Gave you a lot of good information there. Remember, these Kahoots cover questions on exams and HESI and things you'll see on your NCLEX, so they're very important concepts. So I want you to go to your modules. Go to quiz 1, and you may start as soon as you find it. Remember, it is timed 15 minutes.
It says it's locked.
Okay, thank you. Let me go back and find out why. Today is the 18th. I think we're like 2 minutes early. It's all right, I'll change it. Refresh your screen and try again.
Do we keep our Zoom on or we're logging out?
No, you leave your Zoom on.
Okay.
Did that work?
No.
Refresh your screen.
It worked for me.
Okay, if it works for you, it works for everybody.
Okay, so I might not be, I mean,